Danny Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Dr. Anne-Marie Silvestri. She is the Dental Program Manager for San Mateo County Health. Dr. Silvestri, thanks for joining me.
Thank you for inviting me.
And we should preface that you are a dentist, a doctor of dentistry, in case someone didn't get the opening that you're the dental program manager.
Yes, I am a dentist. I've been a dentist for 45 years. I graduated from University of the Pacific when there were only 3 women and 127 guys in the class.
Congratulations.
Thank you. I had the most fabulous and exciting career. In 1980, I came to San Mateo as an extra help dentist as I was opening a new practice in San Francisco. This was after 2 years of being in public health in the city and then going to Kansas with my husband. The county has changed so much, and so have I along the way. At some point, I think it was in 1999, I received a master's in public administration. I stayed with the county on and off. I left in 2000 because I was wanted to see change, and then came back. I've been an instructor at University of the Pacific in emergency dentistry, and then I'm also a member of the California State Board as an expert witness. So if someone complains to the board about a dentist, some of the cases come to me for review.
So now let's specifically talk about what you do as a dental program manager for San Mateo County Health. So it sounds like you haven't been what we would call chair side for a bit of time. You've been administering programs and managing programs. So tell us a little bit about specifically the work you're doing with San Mateo County Health.
I'm actually both. I do chair side, but not as frequently as I used to. Let's put it that way. Like I said, it's just been so exciting. We have 5 clinics in the county. I oversee the 5 clinics in the 3 jails. So the clinics used to just do emergency health, and now we do emergency and we do comprehensive care. We have clinics at 39th Avenue, which is our main basis, and old timers will know it as CHOPE.
Right.
And that clinic opened in 1980, and then shortly after that we opened one in Daly City, then one in Redwood City, and then one in Menlo Park area. So after that, there was a lull in opening clinics, and then when I came back on board in 2006, we opened actually my baby, which is the mobile dental clinic that travels around, that goes to the shelters. We treat the homeless, farm workers, and people on transitional needs. And then in 2013, I believe it was, when Fair Oaks and Willow merged to become Fair Oaks Health Center. We also have a clinic in Coastside, down in Half Moon Bay. So we're pretty much throughout the county, and we're looking to open in South San Francisco at some point.
I think it's important for the viewers today, too, in case they missed any one of the 7 sites, to know if there is a dental clinic in their community. They can jump on your website, and we'll have that up on the banner so that they can just search by their community and see if there's one nearby.
Yes, they can. And our clinics have emergency drop-ins every single morning. So if you're in pain, you will be taken care of no matter what your financial status.
Right. And that was a question I was going to ask you. So the clients that do come see you, are they insured, uninsured, or underinsured?
All above. I wouldn't say insured as much because we don't take private insurance.
Got it.
So we have those that are insured through federal programs, Medi-Cal, health care for the homeless, migrant farm workers. We have those that are not insured that get emergency services but not comprehensive services. And we do have a discounted health program for those people if they need care.
And let's talk about the array of services. Obviously, if we waved our wand and we wanted to say that that we want everyone to have access to oral health, it would be those regular cleanings and those checkups. So what's the variety of services that you provide?
We can provide all services, but that's a very wide statement. Right. We don't have the bandwidth or the capacity to truly do that. So we provide, like I said, emergency services every morning, which is basically going to be an extraction or a deep cleaning. We have a comprehensive program for children that is pretty easy to get into. We have a comprehensive program for adults, which is not so easy to get into. We have a long wait list for those. But besides doing that, I've been very fortunate to have the medical community backing the dental community. And that might seem strange to some, but it very much is. And so our docs will not take a patient to surgery for orthopedic joint, for example, unless they've been cleared by dental. They don't go on oncology treatment unless they've been cleared by dental. The same for cardiology. So we're very lucky that we have people that see the importance of oral health care, and those services we provide. Pregnant women also get pushed to the top of the list because they're only eligible for a very short amount of time if they're on a government program.
Right. Let's talk about oral health. I think sometimes, I mean, even in our own everyday lives, whether or not we are insured or uninsured, or we don't necessarily think about oral health as the top of our priority in health. So, but that's very much not what we need to be thinking or how we need to be thinking. So tell us the importance about good quality oral health.
So after you've hit my passion, I say that the mouth is the portal to the rest of your body.
Right.
Whether you're people with diabetes, people with cancers, people with health needs, a lot of times it's an oral health back and that'll cause a problem. Infections in the mouth are very easy to obtain, and if those go into your bloodstream, you can have a problem. Just oral health in general, if you just think about self-esteem and your looks and all of that, school, they've even said that school attendance is affected by children who may have dental pain and not be sent to school.
Right.
People don't get jobs. So there's a lot on oral health that we don't think about when you just think about.
So given that, then how do we tell the story? How do we ensure that people who need dental services have access to it?
That's a very good question, to be honest with you. You know, we do it at the hospital the best that we can. A thing with me is that it's not offered through Medicare. And I'd like to see that happen someday, even to a limited effect. I don't know how we can offer it to everyone. Just know that your emergency services are available through the county health programs. You know, I'm sure that there's dentists in the community that would do reduced fees. One of the things that we're doing, we've partnered with the dental schools, and we do have University of the Pacific and UCSF dental students and Foothill dental hygiene students and CSM dental assistants come train in our clinics and give them a feel for the importance and how important it is to a low-income population.
Right, and I know that other organizations like Samaritan House and some of the other agencies that you're collaborating with also are trying to provide dental services for adult populations and for others. So it's great to be in collaboration. But what are some of the tips that you can say, this is just about making sure that your teeth are brushed, and we hear the old dental floss every time we go to the dentist.
Brush every day, brush after a meal. One of the things that we're doing too is xylitol gum, fluoride rinses. These things keep you healthy, reduce cavities, but you really need to be checked, and usually it's every 6 months or more for people with periodontal concerns, but I know that cost is often an issue.
Right, and we touched a little bit on it a couple of questions ago, but oral health is a public health. So it's something that, you know, we keep grappling with, and we think about medical care, but oral health is really at the base of all this, as you just said. So how do we ensure that we keep oral health as part of our public health conversation?
I think it's very active in this county. We're very lucky. We do have an oral health coalition. I also work with the San Mateo County Health Foundation to get financial support. It's all financial. It's all financial. Dentistry is expensive. I'm not going to say that it's not, but the everyday cleanings needn't be.
Right.
And it's just to have everyone realize the importance.
Right. And I think what I appreciate so much about San Mateo County Health, whether it's in the dentistry or whether it's in mental health or any of the other medical health conditions, it's a great resource. So perhaps an individual seeking dentistry may not fit for what you do exactly. You have resources to refer, and there's places where people can go that may not fit the exact program that you're implementing. So I love that as a first source resource.
That's true. And also there's the San Mateo County Dental Society where private dentists belong, and they have access to a lot of services too.
Right. We just have about 30 seconds left, so I just want you to be able to tell our viewers a little bit about what you do and or what's the last word that you want to leave us with.
So I have been very lucky to have what I think a fabulous career from early on for 45 years. I will be retiring from the county in March. bittersweet,
Congratulations.
excited but nervous. And what I hope to do is still stay in this field, to work with elected officials. I would really like to see some sort of dental in Medicare. A lot of people don't even know it's not available, even if it's just basic. I know that there's money involved with this too, but I'm hoping that we can find some balance between the need and the availability to provide it,
right,
and the dentists in the community still feeling like they're doing a good part and not losing money.
Well, we look forward to bringing you back when that conversation begins to happen. We know it will if you're behind it.
Thank you.
So thank you so much for your service. Thank you for so much for bringing this important issue to us. And we congratulate San Mateo Health for being part of all of our oral health in our community. So thanks, Anne-Marie.
Thank you.
And we'll see all of you next time on Penn Voice.